us today, with me today, through this session, through this webinar, will be prominent speakers. Both are engineers from computer science and biosciences. So let me introduce Samo Eržen and Marco Benedetto. Samo is from Arctur, from Slovenia, and Marco is from Kelyon, from Italy. I will not introduce them more because they will have opportunity to introduce themselves. So our today dialogue will be on artificial intelligence in medicine, and we will speak about different aspects of this field. So, Samo, Marco, are we ready?
I think so.
Yes, we are. Thank you for having me.
Thank you once more for joining us in this important discussion and dialogue. So you are our stars today. So I will now let you speak more than me. I hope that our question will be interesting to our audience, to our listeners. So let's start from basics. Please, Samo, can you introduce yourself and your company, and how do you contribute to this field, AI field in medicine?
Okay, thank you. Hello, everyone. I'm Samo, as Draga said, and I'm senior engineer and project manager with experience in leading state-of-art project in Arctur. Our company Arctur is private-owned company specializing in advanced and innovative IT solutions with a strong background and focus on research and development. For more than 3 decades, we have been spreading our passion for creativity, collaboration globally from our headquarters in Slovenia, and driven by our goal to develop innovative solutions which we aim to change the world, as our CEO Tommy always reminds us. And we have excellent cloud and HPC, high performance computer services on our cutting edge infrastructure, combined with a team of experienced engineers. Additionally, we own the largest private-owned HPC computer in this part of Europe, and we are also among 20 top research institutions in Slovenia. Also, we possess ISO 9000, 14,000, and 27,000 for security, and soon we will add 40,385, which is obligatory for medical device development. Currently, I'm responsible for, let's say, our flagship and groundbreaking initiative in developing an AI medical device named Classica, which is aimed to revolutionize use of AI in real time in the operating room. So, and I'm really passionate about using advanced technology to improve healthcare outcomes. And I'm excited to share these insights from our journey, brave for 2 years now in this field. So Classica is EU-funded project in the area of medicine and e-health, which spans for 4 years, and we are really in the halfway mark now, 2 years in this project. It's our first project in medicine. This project is particularly exciting because we are integrating advanced AI technology in the operating room to support clinicians in real time during the intervention. This is, may I?
Yes, please continue.
Okay.
But
no,
I already have some questions. Yes, so I'm delighted, you know. So you will just please continue with the bit deeper explanation how it will work.
Yes, this initiative is crucial when addressing the significant issue in medical diagnosis of colon cancer, which I don't know that 20% of biopsy diagnosis are incorrect. Not only incorrect, but they fail 20% of cancer. So our project leveraged the fact that tumor tissue exhibits a different blood flow compared to the healthy tissue. By what we do, in the operating room, clinician administer endocrine green ICG, and with using near infrared camera, we can capture this fluorescent intensity over the time. And then we classify these results, providing this critical information to the surgeon during the procedure. Now, more in this project, we are incredibly fortunate because we have esteemed partners on board, including 5 European university clinical centers, with more expected to join. And additionally, we have collaboration with 2 prestigious law university, Copenhagen from Denmark and Penn State from the United States. And furthermore, IRCAT, which is prominent training center for the clinicians. And I think together we are pioneering this new frontier in medical technology in the surgical intervention. No? More in our project, we have 3 consecutive clinical trials conducted in now 7 hospitals. And in this first phase, which is now ending, we're gathering the videos to develop these AI models. And in the second phase, we bring AI in the operating room to compare the results with the traditional biopsy methods. And only yesterday we were the first time testing this in the operating room
so this is
in Graz. No?
So if I understood
yes.
correctly, when you finish this project, you will have complete study with the clinical testing and everything. So it will be
clinical studies.
Yeah, it will be for 2 years from now. We could use that technology, if I understood correctly.
Yes, this is the aim, because we aiming to then certify as medical device before we have to do the CE mark registration. No? So it's a long way, but it should be done. We will talk furthermore about this.
Thank you very much, Samo. So, Marco, can you please continue with this part to tell us what Kelyon doing right now in relation to AI field, and of course to present us you to us a bit more.
Okay, hello everyone. My name is Marco Benedetto. I'm an engineer. Particularly, I am a biomedical engineer working as solution analyst at Kelyon. Kelyon is a digital health company that has been developing software medical devices and digital health applications for more than 10 years. And we headquartered in Naples, in the southern of Italy, and in Cardiff, UK. At Kelyon, we are at the forefront of integrating some AI solutions into our platforms to create impactful solutions. For instance, one of the projects that I'm working on, and I'm also an executive PhD student, so I'm hands-on on research in Kelyon and in university as well. And we are trying to deploy some AI models to assist physicians in selecting the best antibiotics by analyzing susceptibility data that were collected by microbiologists over the years. The use of these entry-level laboratory data is in its early stage in research. But here in Kelyon, we are ready to test our solution that we developed in a real-world clinical setting, and we are thrilling to validate its performance in a real-world scenario. Another application of AI at Kelyon that I personally worked on is in the field of rare diseases. Here we used unsupervised machine learning techniques to explore genomic and clinical data of patients suffering from a very rare neurodermatological disease. Our aim in this project was to develop new hypotheses to support researchers, clinical researchers, to develop new hypotheses regarding correlations between phenotypes and genotypes that could potentially explain the high variability of clinical manifestations in these patients, because we want to estimate their prognosis and they want to create new monitoring protocols to try to improve the patient care. This example, I think that they are significant because they demonstrate how AI can support clinicians in the clinical day in their daily activities in the hospital. But AI is a powerful tool that can support healthcare organization, research organization as a whole, and of course clinical researchers, because AI can support them to developing new research hypotheses that, of course, with other techniques they can validate. Of course, the bottom line is AI is a powerful tool. The only limit that AI has is our imagination and the business opportunities that we pursue. And at Kelyon, we are committed to harnessing the potential of AI to transform healthcare and ultimately improve patient outcomes.
Yeah. So if I understood correctly, and you both correct me if I'm wrong. So we have from one side we have, let's say, diagnostic from Kelyon through different applications and monitoring, and from Arctur we have field implementation of instruments. Am I right?
Yeah, although we do only the software part, no camera and everything is already in the operating room. So it's
Okay,
the
yeah. So
but
yeah, that was
it's a
my
medical
question,
device
because
then.
yeah, as I said, our target group is white. So we all, when I say all, I mean myself as well, who is I'm not from AI field, tech or engineer. So yes, I think that I could cope with this information. So how challenging is to implement AI? Marco, you said that it's wide field and only our imagination can make bonder to that. But how challenging is that field? What are the limitations of implementing AI technology in healthcare setting?
Yeah, as a data scientist, the first challenge that comes to my mind is that fact that AI models require high quality, a large amounts of high quality data to perform effectively their task. And in healthcare, such as like in many others, real world domain, data is often fragmented, inconsistent, or incomplete. But unlike other fields, health data is often sensitive and its use is strictly regulated. So the legal framework for developing new digital solutions is very complex and requires some time-consuming requirements. Beyond quality and legal aspects and business challenges, another limitation is user inertia. So their resistance to change. Of course, if we use poor quality data or unvalidated solution, we can exacerbate the bias of the models. We can lead models to have discriminatory outcomes and undermine the physician's trust. So to promote the adoption of this kind of new tools in the healthcare, I think that fostering collaboration between data scientists and healthcare profession from their daily activities and also during the educational courses is essential. Healthcare professionals, from their hand, need education and training to increase their trust, and more knowledge on these techniques means that they have more control on them. And on the other hand, as a data scientist, we should be trained on real world clinical challenges because our solutions are not made for our use. They must fully address the challenges that physician has. So one challenge is, of course, to understand the domain, collect quality data from domain, and of course, trying to not fail in the legal framework and in the business scenario.
Yeah, and what besides education, how we can overcome that? Maybe collect data anonymously, of course, because you said it's sensitive, and what this field needs to have more data. What kind of cooperation with different stakeholders, I suppose?
Yeah, cooperation between research organizations, I mean, universities and healthcare organization, hospitals, they collect a huge amount of data. General practitioners collect a huge amount of data, and this should be used to develop new solutions. Of course, having in mind GDPR aspects, scenario, and framework, but we have to use this data. Otherwise, we are very slow as a continent. I mean, as Europe, because other continents, they use their data and they can extract values from that.
Yeah, okay, we'll continue with this a bit later because we have that subject planned through this conversation as well. But I will just now ask Samo, what do you think? What do you think on this? What are challenges and limitations from your perspective?
I'm quite, let's say, hands-on now during the clinical trials and preparing everything for this. No, implementing AI technologies in healthcare comes with a large set of challenges and limitations. One of the primary concerns, and in our project is addressed well, is ethics, because ensuring that AI systems are designed and used in a manner that respect patient privacy, consent is important, and fairness, bias. Um, for instance, AI system must be transparent in their decision-making process to build trust among clinicians and patients. But this is not very easy with AI systems. No, I'm briefly also working in defense, where autonomous weapon system is the same the problem. Who is liable for if something happens? No, who is it? Is the product? Is the behavior of the use to those who use them? So this is really challenging. And when you are in touch with the patient real time and clinician, it's really challenging. No? So in our project, at the beginning, we have decided to maximize transparency using the machine learning algorithms that are explainable and interpretable. Nevertheless, in the second phase, we will also explore and compare deep learning methods, and based on the result, we will decide the final AI pipeline to determine how best use or better combine this information from one or another. No? So this is quite a challenging part. Another significant challenge is time required for clinical trial and extensive documentation. Before any technology can be widely adopted, you must undergo rigorous testing to ensure safety and efficacy. And this involves this lengthy clinical trials and preparation of substantial documentation to meet regulatory requirements. And this process, while absolutely necessary, if I'm the patient,
Yeah, of course.
can really delay deployment of potentially life-saving technologies. And this we see working with two universities from each side of Atlantic, how different is approach in Europe and in States. No? Because in Europe it's very regulatory before you can do something. No? In the States it's more, okay, you can do, but liability is on your side if you do something wrong. And also, while we are approaching the exploitation part, no? Intellectual property rights and patents, oh, it's complex landscape. So protecting the innovation behind these technologies and ensuring not to restrain too much the research and development requires quite careful navigation between this. No? So securing patents is essential to protect the investment and not to put too many barriers to enter to other initiatives. No, so this is okay. We have to be mindful with potential threats such as reliance on AI leading to reduction of clinical skills, no, among healthcare profession. This is very important. No, many years ago we knew many telephone numbers of memory. No, now nobody cares
Nobody knows, yeah.
to store in. So ensuring that AI serves as a tool to augment, no, rather than replace human expertise is crucial. At least I think is still crucial. It will go probably away someday, but now it's still very crucial to have human in the loop. Although human in the loop or clinician decides is not enough, no? Because still we put pressure on him to make the decision like the system suggests, no? And this is wrong because at that part he don't use his knowledge, no? Because he can be scared, she can be scared about making a wrongful decision when suggesting otherwise, no? So this is really challenging.
Yes, you gave us a lot of a few not few, but some points that I would point out. You said transparency. So we have some contrasts. AI will develop fast, but you said that both of you said that gathering data is a bit complicated. Clinical studies are complicated. So, and another thing that you said, expertise is important, but one day we will rely only on AI. So we can maybe discuss it a bit more later when we are talking about ethics. If I understood correctly from this conversation, we can develop much faster AI solutions or softwares, etc., than to gather data. And we can also provide the same things, but clinical studies are still clinical studies. And it's, for now, it's the same as it was. Am I correct?
No, for this
Yeah,
part,
correct.
it should be, as I said, when you are patient, you want to
If you want.
rely on technology, no? When you see the solutions, no, you want to push them. But then it's trade-off always.
Yeah, how it stands with the opinion, I will say common, but maybe it's not. Maybe it's my opinion first, or individual opinion, let's to say, that AI will make faster healing or healthcare. Because now we are talking, it's not like that precisely, but one day it will be probably. And how much AI will help us to have that individual approach. Now we are healing some diseases with a general approach. But with development of AI, will we get opportunity to have that individual approach more than now? Samo or Marco, you can
Yeah, I
jump
think
this.
that this good, yeah, this is direction that we are trying to take in digital health world, because of course personalized medicine is one of the main goal. But of course, to trying to go towards a personalized medicine, we need to have a lot of knowledge of the phenomenon beyond something and behind something. And of course, we have to collect high quality data. Without data, AI doesn't exist. It's just our expertise or our knowledge. AI is just a tool, and we have to trying to use it to extract the potential from a picture of the past that we have collected over the years that is of course data.
Okay, we tackled now our next question or subject, let's to say how AI complement or challenge traditional healthcare practice. You talked about both of you mentioned that part, but because of that I need to ask some additional question, and I know that as scientists you don't like to give those kind of predictions, but how far we are from that personalized healing or medicine or healthcare? What do you think? When you compare how fast AI develops in different fields and in medicine, is it as we are listening by 2060 we will all have that personalized healthcare thanks to
Well,
AI?
actually, I think that we are actually living in a paradigm shift. So we are living the revolution of AI. And I don't think that we can make a forecast of after 5 years from now, because we know 10 years ago we didn't have the technologies that we have now. So I think that in 5 years we will see even things that we cannot imagine right now. We are currently working on AI solutions and trying to integrate them in the clinical process. But yeah, I think that I think that we will experience the digital transformation that we are talking about in these years, in the next years, because it's a transformation. We don't know where it will go. We actually don't know in the EU context if the regulations are too strict or too light, or if there are business opportunities. We actually don't know. And as a scientist, I will reply, it depends.
Okay,
My
Samo.
favorite answer is it depends.
Okay, Samo, do you agree or have something
No,
to?
I absolutely agree, but I was more, it depends, because when we talk with law professionals, it's always, it depends. So that's why I was more in this part. No, we are, let's say, when you are talking about personalized medicine, no, we are more in, let's say, clinical side, no? Although when you want really, let's say, understand person, no, you have to have with the AI system, it's always returns to the data and the biases, because you have to learn, because AI can process and analyze vast amount of data quickly and accurately, but you have to uh, also, when you're preparing the system, no, you have to have, let's say, different data, a lot of different data to understand single than person, where you can put her problems or challenges, health challenges
So we are
they
getting
have.
back, yeah.
So bias is really important when gathering the data. No, you cannot learn, I don't know, some system for, let's say, skin cancer, no, on black people, no, and then use it with the white people, no. This is absolute bias, no. And this is the problem, not only in the health, it's everywhere. This bias is really, so that's why the clinical trials are really prepared to, because they say you have when you prepare the submission for the clinical trial, you have to prepare what will be your training sets, no, and test sets, how you prepare characteristic of the subjects, no, to tackle all the population, no, and this is really important. And this, for this, I think clinical trials won't go away, no. Then we have to be that there will be many solutions for let's say general public, no, where won't go through any clinical trial, and so, and what will happen then when they will give these solutions will give the suggestions or some alarms or something. This will be nightmare probably, no. So having really going through the process of medical device gives you certain credibility and trust. No, this is important.
So yeah, we're getting back on data again. So data, it's very important. And that combination of human and AI touch, let's say like that, let's put like that, not to come in the to have situation that we have a lot of different possible solutions, but not the correct one. Okay, so yeah, I wouldn't be in your shoes right now because I mean, it's a bit hectic, if I may say. So when it comes to Marco, you mentioned that we are in shifting period. So where is AI used now? What are promising applications, or can you please bring us closer a bit? Maybe we already, probably we are using AI maybe through smart watches or some kind of applications already, but we are not aware. And what is the future of applications, AI applications? But when I say applications, I'm not thinking only about a mobile application, but like application in the field also.
Yeah, sure. Maybe we are not aware, but AI is already integrated in many aspects of our lives, from virtual assistants like Siri on iPhone or even Alexa, or to personalized recommendation that we see on e-commerce like Amazon. And of course, many of us may have experienced something with ChatGPT. And these applications demonstrate that AI can reach to general public and to common person and can be used relatively quickly. But in a high risk sector like healthcare, the pace at which this technology become widely available depends on several factors. We have to comply with a complex regulatory landscape for AI and of course for medical devices. And you know, the compliance to these regulations increase a lot the costs of these solutions. So the highest price of this kind of solution may undermine the widespread. And I think the system that we could see in the near future can be systems that, for our perspective, analyze entry-level data in the healthcare organizations and try to support clinicians trying to giving the best patient care. And from our perspective, one solution may be the one that predict the effectiveness of antibiotic treatments. We want to support physicians to make informed decisions quickly using leveraging on data from the past, and of course improve patient outcomes and trying to tackle the antimicrobial resistance as is a global health challenge.
So do we have Samo or Marco? Marco, continue, please, and then Samo, please tell us more. If you know, is AI now in healthcare? Is there anything that we are already use in healthcare, in medicine?
Yeah, sure. AI is already deployed in some imaging tool. There are some in commercial AI-empowered imaging tools that are used in clinical practice. And in this sense, AI analyzes images very quickly, identify abnormalities, and assist radiologists or pathologists in diagnosis very so many conditions. Of course, these are the potential to speed up and improve the accuracy of diagnosis, leading to better patient outcomes. But of course, this change doesn't come without any risk. Using this kind of softwares that are AI unanswered sometimes can can lead physician to make new mistakes, can make mistakes in diagnosis, because I think that AI should be considered like a young and silly, let me say, silly assistant. It can be misleading. It can make hallucination. It can be wrong. So us, well, as human, we are accountable, the one accountable for making decision. And in healthcare sectors, we are the one accountable to make a diagnosis or to prescribe a treatment. So I think that we should treat AI like a younger system, making it resolve some basic problems and leaving us the time to focus on mind-boggling problems or some problems, cases, yeah, that we don't know how to solve, because AI in itself cannot create anything from scratch. AI leverage on the knowledge on the past.
So use AI to brainstorm. Let's put it
Yeah,
like.
yeah, it
Samo,
could be
do
a
you
solution.
have some additional example of usage of AI in healthcare system already, and some future beside your project? You need to unmute yourself. I'm asking. Okay.
Unmute. Okay.
We are hearing.
Yeah, sorry. I don't know. I lost the. So maybe, yeah, in medicine, definitely it is, and definitely we don't know where a lot, but I read in the report from States, it's very fresh, about how many medical device, AI medical device were certified last year, no? And it was around hundreds, no? And then I had a look of the list, and mostly of them are working in radiology because we have data there, no? So it's easy. Then maybe it's to present where we are going, because with Classica we are near time to use it in operating room, no? But we have another project which is basic, no? It's named Custom, and it is introduce a new medical imaging modality to complete X-ray mammogram, no? And but it's safe and scalable. This is quite important, because pregnant women different health issues is prevent to use X-rays, no?
Yeah.
So it's an innovative approach based on ultrasound and supercomputing, no? And aiming to provide more comfortable and less invasive experience for the patient, no? And also gives the possibility to make seat programs, no? This will change, because the breast cancer is the most occurred cancer, no? So absolutely having seat programs, having the possibility to use it on whole population, no? And many times a year to follow possible suspicion on malformations should be really different. But here we are in basic research, and is still in the next phase of project. We go in the clinical trial. Maybe when you have another experience I had working with the startups, no? Wearables can offer monitoring of vital signs, many already available and many more will come absolutely, no? And these devices begin to provide explanations, suggestions, even recommendations, no? And in this first phase is still essential for doctors to review the data, no? And explain the results. But frequently, when I meet with these companies producing variables in this analytic software, no? While I agree that people will buy and use these instruments and software, no? There's a gap when it comes to strategies, how to involve doctors to review this data, because we don't have doctors, no? Not enough, no? And for example, I buy wearable and receive an alarm in the middle of the night. What should I do, no? And it's undoubtedly helpful to have this data, for example, with doctor visit, no? But the knowledge of the doctor is also the problem. But expecting doctor to constantly monitor this data is unrealistic in the present moment. So probably in the future years, no, I'm convinced, no, the gap will overcome with huge advances in large language models and similar technologies. But now we probably will be equipped to gather a lot of data, no? But still need human in the loop. This I think it's important still.
Yeah, especially when it comes to data. So our next project or your next project can be gathering data for this and that. And as we understood, and your permission is proven that data are the most important. And since we have a lot of images, as you said, Samo, and Marco mentioned as well, maybe that's the reason. It is the reason why AI started from using images for diagnostic and potential healing. And while we are approaching to an end, and we mentioned it a lot of times during this conversation, how fast AI healing healthcare will be available to common person, or it will be in beginning? If I understood correctly, everything you've mentioned will be available to any patient. But am I wrong? Or it will be only for a specific group of people? And then please to conclude this this conversation with what we should pay special attention, and I think it's ethics. But you will say. So let's start how AI in healthcare will be available to common person and wider population. And is it now or already? But that concrete healthcare, let's not say about those applications we all have, step counting, heart rate, etc. But when I go to doctor, will it be available for me as common person to have AI healthcare? Samo, what do you think?
But I'm sure that technology is advancing big steps, no? So absolutely we will and we will have let's say how could I put the benefits will overcome all these problems, no? Although I think it's important the regulatory environment also, no? Because if we want to widespread adoption of AI, no? Because the regulatory body need to establish clear guidelines and standards and development to use of these technologies. And I see these problems live, because when we go to regulatory body, let's say for clinical trial, no? They say, oh, it's the first time we do something, not like this, no? So I said, how can we prove that it's reliable and trustworthy, no? And they say, you just write and we will see if you are convincing us, no? So it's really difficult, no? And this, as Marco said before, this period is it's quite challenging for us.
Yeah, but one day you will be proud that you're pioneers in this area, basically.
Definitely, I'm sure. So this is, and then having cost of infrastructure. No, it's also not so only infrastructure, but cost of development. You know, the initial investment can be quite significant. No, so I think it's absolutely important. EU is now subsidize a lot the defense, absolutely, but also health and food. It's absolutely crucial to subsidize costs and provide necessary infrastructure, no? And also in where underserved and rural areas, no, we should because this will bring, let's say, doctor, no, near everybody, no. This is something which absolutely AI will help us, no, to give, let's say, medical. I'm not sure to use care, no, because we we think something physical about care, no, but this understanding of, as you said, personalized medical care, no, to everybody. This is also important, and AI will. It's the only possibility to do this in the future, and it goes there now.
It's a long way, if I understood,
Yeah.
but eventually we will all have our personalized healthcare, and AI will be available
I'm
to
convinced,
all of us.
yes.
Marco, what do you think on this, and what is special? Where to put special attention when we're talking about global healing with AI?
Yeah, I think that the velocity of development of and deployment of this kind of solution is not a problem. We are making a huge leap. We are going very fast. The problem that I can see for its widespread adoption is and of course the policies that promote equitable distribution of these technologies. Because as the cost of this solution rises and the level of education and the digital literacy to use them all they both increases, there's a risk that AI will primarily benefit rich and developed areas in the continent. And of course, bridging these gaps is essential for a widespread of these technologies and its adoption, and ensuring that a fair access in low income and rural areas. Because we don't want that. We want to democratize AI. We don't want that AI is just a tool for rich people to get better care. We want that AI allow us to, as humanity, to get something that is better for us, for our health and our human being as a whole. And of course, the governments and regulatory bodies should really work on these aspects, because, of course, AI costs a lot, costs to make this, to develop this kind of solutions with all the complex and context, the complex legal scaffold that we have to build to develop a new solutions. The costs are very high, and of course, education, the level of education for the users, I mean the users that are accountable for making decision using AI is very high. So if we keep this level high, we don't promote the widespread adoption of this kind of solution without projects like this that promote the education of these technologies to a general public.
Okay, thank you very much. This is very, very nice conclusion for our project. So it only underlines importance of this and similar projects. So thank you. Well, I have, of course, a lot of questions, but now it's time to open discussion. So if anyone have some question, please, now it's time. Maybe just before that, I will try to make conclusion of this. So data, cooperation with human factor and AI need to cooperate. One won't go without another. And ethics. Maybe these are main points when it comes to AI implementation in healthcare. Samo, Marco.
Yeah, I totally agree. Change is inherently a risk, but we have to embrace this change. We don't have to fear new technologies. We have to increase our knowledge and expertise to control this, not to be afraid of.
Thank you, Samo.
Definitely. And I see only benefits in the future and bright future for the medicine. No, AI will do bad things in other fields, but in medicine, I think we will see huge improvements in future years. So absolutely delighted to work in this field.